So I have the order to do a routine tracheostomy care per unit protocol. So I'm going to open my kit, remove my sterile field, keeping a 1-inch border. I'm going to dump my contents. I'm going to take my basin. And now I will grab my saline. I'll check the expiration date. The saline is not expired, so I will remove the lid, palming the label. Now I will remove the oxygen therapy. I will remove the inner cannula. I will remove the old drain pads. I will discard of those. Put my inner cannula into the saline. Replace the oxygen therapy. And then I will remove my gloves. I'll do glove to glove and skin to skin. I will now don my sterile gloves. And I will now arrange my supplies, keeping everything away from the 1-inch border. I will now take the brush and I will take out the inner cannula. I will clean the inside of the inner cannula, clean the outside, discard of the brush, and place the inner cannula into the second saline. I'll now take the inner cannula out. I will take a piece of gauze and I will dry the outer portion of the inner cannula and discard. And I will take the pipe cleaners and clean the inside of the inner cannula, dry the inside, and discard. I will remove the oxygen therapy and I will replace the inner cannula beginning at 9 and ending up at 3. I will now take the Q-tip cotton swab, dip it into the third basin, and I will clean the innermost portion of this stoma. And discard that. We'll now take the next cotton swab and I will clean around the stoma. And discard. I'll now take a piece of gauze and pat dry. And discard. I'll now replace the trach ties. I will replace the new ones before removing the old ones. And whenever I replace the inner cannula, I would stabilize it with a stabilizer device, but I don't have one of those. So now I would normally wrap the trach ties around the patient's head, but mine doesn't fit, so I'm just going to tie it. So I would take my hemostat, I would pull it through, take my hemostats, and I would use these to tie to prevent pushing on the carotid artery. Now I would place a new drain pad. I would remove the old ties. I would replace the oxygen therapy, and I would, whenever I was cleaning, I would note the area around the tracheostoma. Was there any erythema, any drainage, any blisters, any breakage of the skin? I would now perform a respiratory assessment. I would clean the patient's mouth with a toothbrush or a cotton swab with chlorhexidine, and I would also elevate the patient's head at 30 degrees. I would lower the bed, raise the side rails, position the patient comfortably. I would remove the drape. I would remove my sterile gloves. And I would apply clean gloves. And then I would do the assessments and oral care. Now I would document the patient's, how the patient handled the procedure, and I would document the patient's procedure. For the trach care, I would note the stoma, the trach size and type, and did the patient report any pain. For the trach suction, I would report how much drainage, the type of drainage, did the patient report any pain, the suctioning, and I would compare the respiratory assessments. And I would also remove my PPE in the proper order. So I would remove my gloves. I would remove my gown if I was wearing one without touching the outside of the gown. I would remove my goggles, and then I would remove my mask.